Respected Emeritus Chairperson Dr. Swankar sir, Dr. G.N. Saxena sir, Dr. Raman sir, Dr. Lakotia sir, and Dr. Jaiswal sir. Welcome to the 9th PGCR on Healing the Healers, that is managing stress in medical professionals. Chairperson for today's PGCR are Dr. Manju Haskar and Dr. Srishti Jain. Our moderator for this PGCR is Dr. Geetika Chopra from the Department of Psychiatry. As we all know that mental health is essential for doctors and medical students as they face intense academic pressure, long hours of study and long hours of work, and neglecting their mental health and well-being can lead to burnout, anxiety and stress, which can impact their ability to perform and to learn effectively and provide quality patient care in the future. We should remember that happiness can be found even in the darkest of hours if one only remembers to turn on the light. It's very important, mental health, this topic. So we took this topic for PGCR. And now I'll invite Dr. Navya from the Department of Psychiatry to start the introduction of stress.
Good morning, esteemed chairman, respected faculty members, and my fellow residents. I extend a warm welcome to each and every one of you. To set the tone, I'd like to begin with a profound quote by Hans Selye, a pioneer in stress research. Selye pointed out that while stress is an inevitable part of life, it's not the stress itself that causes harm. Rather, it's our reaction to it. While stress affects almost all the profession, today's session will be zeroed down to manifestations and impact of stress on medical professionals. We will be exploring the following topics, and by the end of this PGCR, our aim is to equip you with a toolkit to identify and respond to stress in a more measured and productive manner, and thereby minimizing its negative effects. So let's probe into this topic together. Let's begin with the headline stated in the Hindu that between 2010 and 2019, there was an alarming rate of suicide among medical professionals, with 125 medical students, 105 residents, 128 practicing physicians who attempted suicide. Additionally, there was a dropout rate of 1166 from the fraternity. And similar trend has been seen even after that. These figures illustrate a grim reality. The risk of suicide among doctors is deemed to be 2.5 times higher than that of general population. This image shows the burnout rate across various medical specialties, ranging from 37 to 63%. Emergency medicine had the highest burnout rate, followed by obs and gynae, oncology, and pediatrics. Overall, a heavy cloak of stress hangs over all the doctors, no matter their area of expertise. And most doctors acknowledge this feeling of burnout, which not only affects their personal life, but also impacts their relationship with their patients. They become more easily irritated, prone to making errors, and less careful with patient notes. Before moving forward, let's discuss some real-world cases. First case is of Dr. A 43-year-old male who has battled chronic stress from work-life imbalance and financial worries from the past 7 years, leading to development of unhealthy habits like overeating, excessive coffee, alcohol consumption. He also neglected exercise and relaxation. He believed his stress was normal, as most of his peers faced similar issue. He couldn't acknowledge the severity of his situation. These lifestyle choices resulted in multiple health issues, including GERD, hypertension, dyslipidemia, insomnia, dependence on alcohol and caffeine, and he eventually spiraled into depression. Although medication provided symptomatic relief, it failed to tackle the root cause of his deteriorating health. Now let's meet someone with whom we can correlate very easily. Dr. S, a 25-year-old committed first-year medicine resident, experienced significant stress within 6 months of starting her residency. Faced with heavy workload, unpredictable shifts, and separation from her family, she pushed herself to the physical extremes in the attempt to manage her responsibilities. This physical exhaustion impaired her ability to focus and plan effectively, contributing to errors at work. As stress continued unmitigated, Dr. S began to feel sad and anxious persistently, eventually manifesting the symptoms of depression. And finally, R, an 18-year-old MBBS student who started his journey 2 months ago. While initially thrilling, the demanding nature of his studies quickly overwhelmed him, leading to palpitations and restlessness. Instead of seeking support from his friends, R withdrew and isolated himself. Unfortunately, this isolation compounded his stress, forming a vicious cycle, where heightened stress levels led to further withdrawal and deepening of loneliness. So, what is common among these all cases? Can anyone guess? Yes. Stress. So let's understand stress better. A simplified definition says that it is a state of tension that arises when you experience demand from your environment or from within yourself. It can be real or perceived threat. And when this stress becomes chronic and revolves around workplace, it is known as burnout, which is characterized by these additional dimensions. Emotional exhaustion from excessive psychological demand, feeling of lack of personal accomplishment and loss of self-worth, and depersonalization leading to detached and callous attitude. This chart shows that job stress is a major problem for medical professionals. Over half, which is 53%, feel that most of their stress comes from work, and another 30% says that it is their only stressor. So what contributes to this stress? It is excessive bureaucratic tasks, patient characters like being demanding, entitled, poor adherence and compliance, long work hours, sleep deprivation, lack of respect from colleagues and administration, loss of meaning in medicine and patient care, that is decreased support, increased responsibilities, etc. Methods of dealing with death and suffering, which is more common among oncology, critical care and palliative care. Irrational belief regarding demand from self, others and from the world that everyone around them should be perfect. We are generally aware of these issues, but let's gain more insight on personality types and problem with work-life balance. Our personality also contributes to stress. Back in the day, Friedman and Rosenman divided two types of personality, type A and type B. Type A are the go-getters, the competitive bunch who always strive to achieve. They might get a little impatient and fired up easily, but their focus and determination can be a real asset in high-pressure situations. On the other hand, type B are more easygoing and less competitive bunch. They tend to be more relaxed under pressure. So which type do you think is more common among medical professionals? That's right, type A. And this personality type is also more prone to stress. A balanced life is referred to as maintaining a healthy equilibrium across all key life areas as shown in this chart. This chart depicts the severely imbalanced lives that many physicians and residents face, with work consuming the vast majority of their time and energy, to the point where all the crucial aspects are neglected. We often think that stress is negative, but is there another side to the story? This image illustrates the stress curve, depicting the varying effects of different stress levels among professionals and performance and well-being. On the left side of the curve, we have too little stress. It can lead to feeling of boredom, fatigue, and lack of motivation. In the center, we have the optimum stress level, where we experience increased focus, alertness, and productivity. And as we move to the right side, and we enter the stage of too much stress, it leads to feeling of anxiety, anger, and eventually burnout. Now I would like to call upon Dr. Pragya Jain from the Department of Physiology to shed some light on physiology of stress.
Good morning, all respected dignitaries, faculty members, and my colleague. I am Dr. Pragya Jain from Department of Physiology to discuss physiology of stress. So as Dr. Navya has reflected upon the stressors, so whenever our body is exposed to some stressor, some physiological changes occur that is called general adaptation syndrome. It includes 3 stages. Stage 1 is alarm. In this, our body reacts to stress, and there is activation of 2 systems, that is sympathetic nervous system, and other one is hypothalamic pituitary adrenal axis. Stage 2 is resistance stage. In this, adaptation to stress occurs, and there is sustained release of cortisol hormone in order to maintain arousal. And stage 3, either recovery or exhaustion occur. If there is acute stress, recovery occurs, and in case of chronic stress, the body's resources have been depleted and exhaustion occurs. So when hypothalamus is activated, whenever a stressful situation is identified, there is activation of 2 systems. First is sympathetic adrenal medullary system. So body is exposed to acute stressors, hypothalamus is activated, and there is activation of adrenal medulla that causes release of adrenaline and noradrenaline. That causes flight or fight response. And in chronic stress, there is activation of hypothalamic pituitary adrenal axis. In this, hypothalamus is activated, that causes release of CRH, that is corticotropin releasing hormone, that causes activation of anterior pituitary gland, that causes release of ACTH, that is adrenocorticotropic hormone, and it causes activation of adrenal cortex that releases cortisol. So in flight or fight response, there are some physiological manifestations like pupils are dilated, bladder relaxes, piloerection, digestion is slows down, adrenal produces hormone, increased gluconeogenesis and glycogenolysis, and rapid breathing, and muscles become tense. These are the systemic manifestation of hypothalamic pituitary adrenal axis activation. In this, increased gluconeogenesis, glycogenolysis, decreased insulin secretion, increased proteolysis, increased lipolysis, increased bone resorptions, and increased sodium reabsorption and potassium secretion. These are the various neurotransmitters and their level in stress. So, gamma aminobutyric acid and norepinephrine, these both are increased in response to stress. And dopamine, serotonin, melatonin, and glutamate, these all are decreased in response of stress. Now, to discuss the systemic manifestation of these hormones, I like to invite Dr. Yash from Department of Medicine. Thank you.
Good morning, respected professors and seniors. Today I will be discussing the systemic manifestation of stress. So, continuing our exploration into the intricate physiology of stress, as discussed by Dr. Pragya Jain, today we will delve into the profound outcomes of the stress on the human body. Stress is more than just a mental burden, it's a complex disorder that affects both the neurological and hormonal axis. Its wide-ranging effects can lead to several health issues, including depression, mood changes, infertility, peptic ulcer, etc. Let's briefly overview these effects as comprehensive. Discussion on this topic is beyond the scope of a single session. Starting with the brain bears the brunt of the stress. Stress leads to BBB leakage or blood-brain barrier leakage, leading to involvement of various regions, neuroinflammation, and imbalance between the inhibitory and excitatory neurons. Such changes are linked to several mental health issues. Stress significantly impacts the brain, which can cause various adverse effects such as anxiety, depression, and cognitive impairments. Furthermore, stress induces dysregulation of the circadian rhythm, leading to alteration in hormonal and neuronal pathways. These changes manifest clinically as insomnia, altered bowel habits, increased irritability, further compounding the challenges associated with the mental health disorders. Moving beyond the confines of the brain, stress casts its shadow over the immune system, inducing immunosuppressive conditions through hormonal exhaustion. This manifests as a decrease in baseline leukocyte number and functioning, result in delayed wound healing, heightened susceptibility to infections. Moreover, stress has a pro-inflammatory potential, while mildly protective, is strongly associated with autoimmune diseases. The gastrointestinal system too falls victim to the onslaught of the stress. Hormonal and neuronal responses leads to decreased gastric motility and increased colonic motility, predisposing individuals to spectrum of disorders including Crohn's disease, gastritis, GERD, IBS, and ulcers. Metabolic syndrome emerges as a hallmark consequence of stress, as activation of sympathetic nervous system and HPA axis culminate in the cortisol release. This cascade results in insulin resistance, obesity, hypertension, dyslipidemia, collectively contributing to the metabolic derangements characteristics of this syndrome. Finally, the stress significantly impacts the cardiovascular system, with the SNS activation leads to increase in heart rate, vasoconstriction, endothelial injury, and over time, these alterations predisposes individuals to a spectrum of cardiovascular diseases, including myocardial infarction, arrhythmia, etc. So, to conclude today's presentation, as elucidated the complex dynamics between the stress and the systemic impacts, underscoring the significant implications of stress on the health and well-being. Now, I would like to call Dr. Nandini Bharadwaj from the Department of Psychiatry for further discussion of psychiatric manifestation and pharmacological management of the stress.
Good morning to all the dignitaries and respected faculty members and my dear colleagues. Moving forward with the topic, I'll be discussing the psychiatric manifestation and pharmacological management of stress. Up to this point, we have observed that while stress is a common experience for everyone, it impacts each person uniquely. Individuals respond differently to the same levels of stress. But why does this happen? Here is a theory behind this that is known as stress diathesis model. As you can see in the graph, that when stress level rises, symptoms only appear if an individual's vulnerabilities are high, which is termed as diathesis or inherent susceptibilities. It is determined by a combination of following factors, that is genetic, childhood trauma, cognitive and neurological, stressful life events, social predisposition, and temperament. That increases the risk of developing mental health conditions when combined with stressful environment. In simpler terms, some people are more likely to experience symptoms even with low stress levels due to these inherent vulnerabilities. Can you give some examples of things you might feel if you suffer from stress? Anyone? Yes. Identifying signs and symptoms of stress is a key step in stress management. At some point in our life, by far, we must have felt it, and some of us are still experiencing it, trying our best to ignore it. Now let's take a closer look at these unhealthy signs and symptoms. Starting from the left side, symptoms seen are distancing themselves from the loved one, lower sense of accomplishment at work, lack of flexibility, sleeping too much or too little, either taking prescription or over-the-counter drugs, indulging in substance abuse to relax, undereating or overeating, increased screen time, lashing out at others verbally or physically, and other ongoing symptoms include loss of motivation, committing medical errors, negative outlook and inability to concentrate, coming to work late and leaving early, not answering essential phone calls, frequent headache and muscle aches, feeling helpless or trapped, and eventually resorting to mindless escapes may provide temporary relief, which often create more problems in the longer run and fail to address the root cause. Now let's try to understand 5 key warning signs of stress through this video. These are crucial for recognizing when you or someone you might know need to take a step back and seek support.
5 signs you're stressed at work. Number 1, you have a short fuse. Number 2, you think about work all the time. Number 3, you can't focus. Number 4, you aren't sleeping well, or at all. Number 5, you're withdrawing from social situations.
Stress acts as a precipitating factor in various psychiatric illnesses. While the full range of these illnesses is vast and beyond the scope of a single session, it's critical to acknowledge this connection. These are some of the common mental health conditions stemming from stress. This picture shows a meta-analysis of studies from Indian Journal of Psychiatry in 2023 on the prevalence of mental health outcomes in healthcare professionals, indicating that depression, suicidal ideation, anxiety disorder, insomnia, and substance use disorder are some of the most common occurring psychiatric conditions due to stress. Here we can see that burnout in Indian doctors ranges from 16 to 80%, while depression is around 40%, which is higher than any other medical professionals worldwide. Many people often feel confused about distinguishing between symptoms of stress and symptoms of anxiety or depression. So let's address this issue and provide clarity on identifying the peculiarities of each. Let's differentiate stress from anxiety. There are few symptoms that are common: fatigue, insomnia, irritability, muscle tension, difficulty in concentration, increased heart rate, headache and chest pain. Whereas symptoms of stress are of shorter duration and often triggered by a specific situation and subsiding when the pressure eases. On the other hand, anxiety may be a result of prolonged stress involving avoidance behavior, that is avoiding situation that may trigger anxiety, feeling of fear and nervousness which are out of proportion to the given situation as shown in the figure. Now let's examine the difference between stress and depression. The relationship between stress and depression is complex and bidirectional. Stress can lead to depression, and conversely, experiencing depression can increase one's sensitivity to stress. According to DSM-5-TR, depressive episode is characterized either by depressed mood or loss of interest, and at least 4 of the following symptoms, that is change in appetite and weight, sleep disturbances, psychomotor agitation or retardation, fatigue, feeling of guilt or worthlessness, executive dysfunction, and suicidal ideation for duration of at least 2 weeks. As it's clear that stress impacts everyone, and let's explore how prominent and flourishing personalities manage their stress.
Ups and downs you always have in life. You will have more of it, don't worry. But the fact that you recognize it, and the fact you recognize that really drains you down, is enough for you to know that you will overcome it. You have to motivate yourself. You have to motivate yourself because what comes from within is the one which stays with you. I can tell you 10 things and go away today, but unless you self-motivate, say, hey, come on, yes, ups and downs, yes, today was a bad day, but I will see tomorrow.
One thing I would definitely say is there's no do or die in this world. Nothing is important enough for you to take so much pressure that it defines your life. You have to be like water. Learn to be like water, adaptable, fit into any vessel, have a sense of calm, have a sense of
stress of anything, it could be anything that triggers it. It's very important to have conversations around it because only when you speak do you find solutions, and there is a reason why people within the bubble like to sit and have discussions about how they feel. You need to share experiences, you need to discuss things to share that load off you and understand, okay, I'm not the only one feeling like this, and I feel supported with the fact that everyone around me is feeling so.
Despite the fact that there is a high level of mental morbidity among medical professionals, why is that medical professionals do not seek treatment? To enlighten you, there are various reasons, including stigma being a crucial one. The stigma being that others would think less of them. Additionally, time constraints, lack of awareness about stress, and a preference for self-management over seeking help. Doubts about treatment efficacy, worries about confidentiality breaches, fear of negative impacts on academic records and career advancement further contribute to this reluctance. Up to this point in our presentation, we have delved into various aspects of stress, including stressors and their manifestation. Now it's to shift our focus towards exploring approaches for effectively dealing with these stressors. For dealing with stress without psychiatric illness, non-pharmacological approaches are the mainstay. However, relief using anxiolytics for short-term duration may be useful. Whereas in cases where psychiatric illness has emerged, the most appropriate medications are those for the primary psychiatric diagnosis. Hence, in cases like these, antidepressant, mood stabilizer, antipsychotics, anxiolytics are used. Now, I would like to call Ms. Lakshmi Raj Rathod from Department of Clinical Psychology to discuss non-pharmacological management.
Good morning, all. So moving to non-pharmacological stress management, effective stress management involves the following: learning to recognize the signs that we're experiencing stress, then recognizing the circumstances that trigger stress reactions in us, and finally applying stress management techniques to help us cope. So, one good way is each time we feel stressed, making a note of it in our journal or using a stress tracker on our phone, writing down what caused us stress, how we felt both physically as well as emotionally, how we acted in response, and what we finally did to make ourselves feel better. Now let's watch a short video explaining to us what happens to us during difficult times.
Difficult thoughts and feelings are a natural part of stress. Problem comes when we are hooked by feelings and thoughts that are long pressed. Just like when something is on hook, it cannot get away, no matter how much it wriggles and sways. In the same way, we can get hooked onto difficult thoughts and feelings. One moment, you might be playing with children, and the next moment, you might be hooked by difficult thoughts and feelings. One moment, you might be enjoying sharing a meal, and the next moment, you might be hooked by an angry feeling. Let's look at more thoughts and feelings that can hook us. Thoughts about giving up, thoughts that blame others, harsh judgments about ourselves, Wrong beliefs, patterns, and memories don't help. Thoughts about the future, especially about what we fear. Thoughts where we worry about near and dears. These are some examples of thoughts and feelings that hook us, pull us away from our values that guides us.
Now let's look at some tools that can help us with this. So the first tool is unhooking, which starts with noticing and realizing that we are distracted by a difficult thought or feeling and noticing it with curiosity rather than any judgment. Then naming the difficult thought or feeling, such as I can feel myself getting upset right now, or here is a difficult thought about the past. Then refocusing on what we're doing, paying full attention to whoever is with us at the time, bringing us to the second tool of mindfulness. So mindfulness is nothing but being present in the here and now, and you can practice it with any activity in the day, whether it's mindful eating, whether it's giving your 100% attention to your patients, whether it's mindful technology use. Now let's look at the next tool with the help of this video.
Grounding. Strong emotions can overpower you, like a storm. Imagine you're in a tree when a big storm comes. You'll be blown around if you're high up, but if you get to the ground quickly, you can look after yourself and others while the storm passes. So, how do you ground yourself? First, notice how you are feeling. Then, connect with your body by slowing your breathing and pressing your feet into the floor. Then, refocus on the world around you, the sounds, the smells, and the sights. And soon, you will feel more grounded. This technique doesn't make the storm disappear, but it does keep you safe until the bad weather has passed.
So an easy way to remember this tool is by the 5-4-3-2-1 method, where we try to find the 5 things we can hear, 4 we can see, 3 we can touch, 2 we can smell, and 1 we can taste. Acting on our values is the next tool. So when we are stressed, we usually move away from our values. Values are nothing but the guiding principles of how we want to treat others and how we want to treat ourselves in the world. So you can choose a value that is most important to you. For example, being kind and caring. Then picking one small way that you can act according to these values in the next week. Being kind to yourself is also very important, which includes validating your feelings, setting boundaries, practicing self-care daily, and challenging negative thoughts such as I'm a failure. Expressing gratitude at the same time is also important. So gratitude doesn't always have to be about the big things in life. It can be about something so small as having food to eat or having reached home safely. Adopting a healthy lifestyle while we practice all of these tools is also important. So even if you're not able to get enough hours of sleep, to make sure that the quality of sleep is still good is important. Now let's look at some additional ways to manage stress.
Organise your time based on your energy levels. Try not to do too much at once. Take breaks and take things slowly. And set yourself smaller, more manageable goals so that you can see your achievements. Practice saying how you feel. If people are making unreasonable demands of you, it's okay to tell them this and say no. Develop your interests and hobbies. They can be a great way to get away from everyday pressures. Shared hobbies can also be a good way to meet new people. Look after your physical health. Taking steps to look after your physical health can reduce stress, although this can sometimes be difficult. Try getting enough sleep and eating regular meals to make a difference. Find ways to relax. If you know that something relaxes you, like listening to music or being creative, try to set time aside to do this. Give yourself a break. Reward yourself for achievements, like finishing a piece of work or making a decision. You can take a walk, read a book, or simply reflect and be proud of what you've achieved. And forgive yourself if things didn't go to plan, or if you didn't do something you'd hoped for. Nobody's perfect, and putting extra pressure on yourself doesn't help. Build your support network. Whatever you're going through that's causing you stress, you don't have to cope with it alone.
And not try to control the uncontrollable. Finally, It's important to recognize that seeking professional help when needed is not a sign of weakness but of strength, and you can always ask for more help if you're not able to cope up using the tools already that have been described. Now, I would like to invite Ms. Megha Rajawat from the Yoga and Naturopathy Department to discuss the role of yoga and stress.
Good morning, respected faculty. Before we talk about how yoga and naturopathy can help with stress, let's understand what yoga is. Yogaste kurkarmani sangram taktva dhananjaya siddha siddhi samo bhutva samtam yoguchyate. In the Bhagavad Gita, Arjuna faced a tough choice between his duty and what he wanted to do. This struggle is something we all go through. But with Lord Krishna guidance, Arjuna learned to be even-minded when facing success or failure and not worry about result, as known as yoga. As we move forward, yoga 8 limbs called Ashtanga, Yam, moral observance, Niyama, self-discipline, Asana, posture, Pranayama, breath regulation, Pratyahara, sensory withdrawal, Dharana, concentration, Dhyan, meditation, Samadhi, integration. Offers a complete approach to stress, relief and well-being. This practice promotes relaxation, mental clarity and emotional balance by activating the body's parasympathetic system and reduce stress and mental inner peace. These are various types of asana that are particularly helpful in stress management. The initial 5 poses not only relieving stress but also strengthen the muscles of the spine, which is crucial for medical professionals who often have long sitting hours. The supine twist is beneficial for loosening weight to hip circumference. Lastly, Shavasana is widely regarded as the simplest asana and require minimal assistance, make it accessible for everyone. These are some convenient asanas suitable for medical professionals to practice amidst their hectic schedule or in the workplace. Pranayama is another well-known yoga practice that most of us are familiar with. It involves consciously controlling inhalation, exhalation, and the pauses between breath to regulate breathing. Let's participate in Pranayama exercise through this upcoming video.
Ujjayi breathing. आपकी spine straight रहेगी, आपके lips बंद रहेंगे, nostril से inhale करेंगे, दाएं में बंद बनाएंगे, nostril से ही exhale करेंगे. Alternate nostril breathing. अपने राइट हैंड से स्टार्ट करेंगे. आपकी फर्स्ट फिंगर मिडिल फिंगर बेंड रहेंगी. अपने राइट थंब को राइट नोस्ट्रिल में लगाएंगे. लेफ्ट नोस्ट्रिल से इनहेल करेंगे. अपने रिंग फिंगर से लेफ्ट नोस्ट्रिल को प्रेस करेंगे. राइट नोस्ट्रिल से एक्सहेल करेंगे. राइट नोस्ट्रिल से इनहेल करेंगे. अपने थंब से इसको प्रेस करेंगे और लेफ्ट से एक्सहेल.
These are some naturopathic techniques for managing stress. It includes head massage, Shirodhara, aromatherapy and mud therapy. Every year, Yoga Day is celebrated on 21st June at our university. Now I invite Dr. Geetika Chopra ma'am, Assistant Professor from the Department of Psychiatry, to take podium. Thank you.
Good morning, esteemed faculty members, seniors and dear residents. As we conclude this PGCR, let's revisit the case studies we shared earlier. These case studies provide a comprehensive overview of the stress experienced by medical professionals at different stages in their career. If I have to summarize this session, this case is a prototype helping us understand all the topics what we have covered today, starting from presence of stressor and awareness about symptom of stress and its severity, and ultimately leading to the physical as well as psychiatric manifestation. As Dr. A was already put on proton pump inhibitor, antihypertensive and statins for his medical diagnosis, but still he was not feeling good or better, and to manage his illness, Dr. A required a comprehensive holistic approach including both pharmacotherapy and non-pharmacological management. To address his depressive symptoms and substance use disorder, we can use SSRI and benzodiazepine For treatment of his alcohol dependence, the alcohol detoxification and de-addiction plan will be useful. As Dr. A is struggling with work-life balance and financial worries, so in non-pharmacological approaches, the activity rescheduling and time management skills will be useful in this case. Unhooking mindfulness and improving communication with family will be advised to him. And to manage his financial problem, the 5 approaches of financial management will be used in this patient. As he is already having problem with hypertension, dyslipidemia, insomnia, GRD. So yoga, naturopathy and lifestyle modification is overall effective for all of his symptoms. And particularly in this case, one crucial step to make him recognize that the root cause of his illnesses is his stressor. So we make him to understand that stress is impacting him so much and ultimately leading these all of illnesses. Now moving to the case 2, we observe psychiatric manifestation in this medicine resident. Here, have a dual approach is necessary. Yes, sir, real cases. In the case 2, Miss as a female medicine resident developed a psychiatric manifestation. So here a dual approach is necessary, involving pharmacological approaches as well as non-pharmacological approaches. In a non-pharmacological approaches, restructuring negative thoughts and problem solving will be useful along with the SSRI and benzodiazepine. These options will be addressed her depressive symptom, as she is having stressor as a heavy workload, unpredictable shift and separation from his family. So time management skills and better problem solving skill to be advised to her. And I would like to mention here that NMC also acknowledged this situation all around the India and released a notification in the 2022 and emphasized that postgraduate medical students should take adequate rest periods between shifts, the implementation of regular weekly off, access to the counseling services, arranging yoga session for stress reduction and fostering a positive working environment for them. Even 1 week ago, NMC also announced a national-wide survey on the mental health of medical students to address the rising cases of depression, ragging and suicide. The survey aims to find out reason behind stress, more feared factors and impact of workload in medical students. The link is shared here, and we also shared a QR code to filling this Google form, and 2 days is the last day for the submit your responses. Now coming to the final case. This is a case of medical student experiencing stress, but in this case the psychiatric illness has not emerged yet. So in such scenario, non-pharmacological approaches are the mainstay of the treatment. Practices such as mindfulness, grounding techniques, along with adopting a healthy lifestyle and incorporating yoga and naturopathy can effectively help the MBBS student to deal with the stress and prevent the worsening of the symptoms. So conquering stress is unique to each of us. It depends on what triggers you, your daily life, your working routine. So this is a toolkit, provides a variety of approaches, whether you want a long-term strategies to manage stress or whether you want a quick fixes, whether you are battling stress at home or other key areas of your life. We trust that today's PGCR session has provided valuable insight into managing stress. As we come to a close, I would like to leave you with some food for thought with this video.
तुम्हें किसी को कि तुम 40 तक जिंदा रहोगे? यही क्या फर्क है 70 साल और 6 महीने? बहुत एक बड़ा बाबू मचाए। उन चीजों के लिए वक्त निकालो जिनसे तुम्हें सचमुच खुशी मिलती है। जो दिन जो घड़ी जो खुशी जो भी जिंदगी में मिले उसे पटो लो। Seize the day, my friend. क्योंकि ना जाने कल ये दिन ये घड़ी ये खुशी फिर मिले ना मिले। पहले इस दिन को पूरी तरह जियो,
फिर 40 के बारे में सोचना।
जब तक जिंदा हो तब तक मना नहीं, जब मर गया साला मैं नहीं। तो डर के बाद क्या? अरे फ्यूचर से इतना डरेगा तो क्या खाक जिएगा और फोकस कब करेगा आज में?
जितना भी ट्राई करो बनी, लाइफ में कुछ ना कुछ तो छूटेगा ही। तो जहाँ है वही का मजा लेते हैं।
जन्म कब लेना है और मरना कब है हम डिसाइड नहीं कर सकते, पर कैसे जीना है वो हम डिसाइड कर सकते हैं। आप कहना क्या चाहते हैं? हम एक बार जीते हैं, एक बार मरते हैं। Take your chance, baby. सुनो, जियो, खुश रहो, मुस्कुराओ, क्या पता कल हो ना हो। अब जाए।
So, thank you all for your taking the time to be here today. Your focused attention made this a truly engaging session. Now, I would like to express my sincere gratitude to esteemed Emeritus Chairperson for sharing your valued time. And thank you also for the respected Pro VC Sir, VK Kapoor Sir, Dr. GN Saxena Sir. Thank you to the dedicated PGCR committee, and especially thanks to the Dr. Mukesh Sarna sir, who granted us the freedom to shape this PGCR as according we want and guided us at the same time. Thank you for the department head of psychiatry, medicine, psychology, naturopathy for your incredible support. And finally, a big thank you to all our dedicated PG residents. This session wouldn't be a stress-free without all of you. Thank you so much. So this is the QR code which we shared which we talked about earlier. Survey on mental health and well-being of medical students and faculty in the medical college. You can submit your response through this scanning QR code. And now another interesting initiative taken by Dr. VK Kapoor sir on PGCR on how to make a presentation. So this is the Google form link which will be shared by the WhatsApp group also. And please submit your responses through this Google form. Thank you.